As a society, we need to speak about mental health. Now, I'm not saying that only people with mental health conditions have suicidal ideation, but it is the fact that many people with mental health conditions or psychosocial disabilities may experience, suicidal ideation at one point or another in their lives. And given the stigma that we have in society around mental health issues broadly, many people go through these conditions in silence without speaking up, without speaking out, without seeking help. My name is Dr. Elizabeth Kamundia, and I work as an assistant director, and I'm also the disability focal point at the Kenya National Commission on Human Rights. The Commission is bringing a petition, a constitutional petition, to declare Section 226 of the Penal Code as unconstitutional. This is the provision of the law that makes attempted suicide an offense that is punishable. Now, if you look at Section 36 of the Penal Code, with up to 2 years imprisonment. Of course, the approach of the Commission is that this is a provision of the law that is a violation of human rights, that is really a violation of the right, particularly to the achievement or the attainment of the highest attainable standard of health, because really the impact of criminalizing attempted suicide has a negative impact on people seeking help when they're in psychological distress. In this journey, we are collaborating closely with a network of mental health, of stakeholders, of civil society organizations that work on mental health. We, as a commission, we are the monitoring agency on the rights of persons with disabilities. And in our role as the monitoring agency, we convene a network of stakeholders on mental health. And so we've discussed this petition with them. We've gotten their insights. We've gotten different perspectives, impact of this law on families, as well as on people who are already serving time for this offense. So we have those partners. We are also partnering, very importantly, with the Kenya Psychiatric Association, which is the professional association of psychiatrists in Kenya, who are bringing on board the scientific evidence on the reasons why this law is, flawed and outdated at this stage in time. And as importantly, we have with us someone with lived experience of mental health conditions, of having a mental health condition that has resulted in suicidal ideation. This is Charity Muturi, who is the second petitioner in the case.
My name is Charity Muturi. I have lived experience with a mental health condition. I do advocacy and policies for mental health and non-communicable diseases. I served in the National Task Force on Mental Health and currently serving as a petitioner in the Decriminalization of Suicide in Kenya. For many years, criminalizing suicide has been seen as something that discourages people from attempting suicide. And so across the world, many countries have had suicide as a crime. But what we have realized with time is that this discouragement that is supposed to be actually leads people to not talking about their suicidal crises or when they have mental health challenges. And so the World Health Organization and the International Association on Suicide Prevention have confirmed in different countries and have cases where suicide has been decriminalized, then we have more people reaching out for help and the completed and attempted suicides go lower. And so I, as someone who has experienced suicidal ideation for the last 27 years, and from when I was 14, I could not talk about it because I knew that it is not accepted morally, it is not accepted religiously. And so I only talked about it 3 years ago. And it is only then that I was able to get support. When I learned that it is a crime, it made me keep quiet even more. Because then I feared. And now, even when I would plan for suicide, I would plan 3 means so that if one doesn't work, the other 2 do, because I could not risk going to prison. And so from experience, I can say that suicide should not be a crime.
If we normalized conversations around mental health in the same way conversations around physical health are, you will tell people I have a cold, quite, ordinarily and quite normally. But it's rare that when someone asks, how are you, that you will really respond and say, oh, I've been feeling down for a while now.
This is the reason why we are doing advocacy, not only for decriminalizing suicide legally, but we are going beyond that to say that we need to decriminalize this in our religious, social, and cultural environment. When we have suicide as a crime, it means that people then fear to talk about it because they fear the legal consequences.
Another thing that we need to do as a society is, particularly now, government obligations to ensure that mental health services are accessible to people within the communities in which they live. I think one of the disadvantages of having mental health, services accessible usually when issues are very acute at Mathari National Referral Hospital is that we don't catch, mental health distress or mental distress at initial phases. So people wait until they are very, very distressed to seek help or to have their family members come around them to enable them to seek help.
The nature of therapy, of psychology, is that you would need to do several sessions. Yeah. So most times you need 5 to 10 or above. And so when we have therapy at 3,000 to 5,000 shillings per session, it is not easily reachable for the majority of Kenyans.
I also think, of course, there are the socio-economic determinants of health. It's all very good of mental health. It's all very good to talk about medicine and access to psychologists and psychiatrists, but also the prevention angle is around, do people have jobs? Are people able to have a living? Are people accommodated within their workplaces if they have these conditions? Are students being sent away from school if they display behavior that should ideally, have them be supported more, or, have the safe spaces within work, within schools, within our communities? And so I think it's broad. It's a broad range of issues that we need to address as a society.
I am currently a court petitioner on the decriminalization of suicide. We are partnering with the Kenya National Commission on Human Rights because it is actually against our human rights to be taken to a prison instead of being taken for access to health services. So we are partnering with the Kenya National Commission on Human Rights and the Kenya Psychiatric Association, which is very important because our psychiatrists are dealing with patients every day at risk of suicide. And they find that sometimes patients don't even talk about it because they know that it is a crime. So together with the Kenya National Commission on Human Rights and the Kenya Psychiatric Association, we are changing the narrative to say that suicide should not be a crime legally. And we are also calling upon our religious leaders, our community leaders to also decriminalize suicide in our religious, social, and cultural environment.
So to anyone who may be feeling suicidal right now, I think the first point I would make is to you as a human being, to say that you are not alone, to say that you matter, to say that your life is worth saving. That's the first point I would make. The second thing I would say is that, from a human rights perspective, you have a right to the highest attainable standard of health, including mental health, and that help is available. I would implore you to call 1199, which is the Kenya Red Cross toll-free line for offering support to people who are in mental or psychological distress, and you will get help.